So for the first scenario, if I were speaking to the patient, I would say, you're scheduled to receive your aspirin in 1 hour at 8 a.m., and it's 7 a.m. now. I can administer your medication now, or I can also offer you non-pharmacological pain interventions, such as repositioning or the application of heat or cold, and that may be able to help you until the time at which your medication is scheduled, but you can choose whether you would like your medication or you would like a non-pharmacological intervention. For the second scenario, when I would respond to why he needs to take the Lasix, I would say Lasix is a loop diuretic. You may also know it as your water pill. And basically, Lasix prevents your body from absorbing too much salt, and it reduces the fluid retention that's caused by your congestive heart failure. You have to keep taking this medication, and unfortunately, the medication works by making you pee, so I can't fix the fact that when you take your Lasix, you are going to have to pee a lot. However, we can change the times at which your Lasix is administered, maybe to earlier in the day, so maybe 2 hours earlier, so 6 a.m. and 6 p.m., in order to reduce the amount of times that you have to get up to pee overnight, which can maybe get you a better night's sleep. Okay, so right now I'm going to be performing the administration of Lasix for the patient. So here we have the furosemide, and this is our medication administration record, our MAR. So I'm going to do my first checking that it's the right med, furosemide, right patient, Sam Smith, right route, PO, right time, 8 a.m., and right dose, 40 milligrams. All right, now that I've performed my first check, I'm going to be putting the dose into the cup. So I'm going to check again, furosemide, Sam Smith, PO, 8 a.m., 40 milligrams, and then I'm going to put the dose into the cup so you can see.
Hello?
Hi, Mr. Smith. How are you today?
I'm good. How are you?
Good. So I'm just going to be administering your Lasix for you, okay? And do you know what you take your Lasix for?
I think that's for my heart.
It is. It's a diuretic, so it helps with your fluid retention, and it's for your congestive heart failure. So you're right.
Okay.
So here I'm just going to be checking your meds one last time. Furosemide, Sam Smith, PO, 8 a.m., and 40 milligrams. So here is your med, and here is a water for you to take it with. Here you are. All right.
Got it. Thank you.
Of course.
You have a good afternoon.
Thank you. So for the third question about the CT scan and the with the contrast dye, my first action would be to call the provider, and I would use the SBAR format, and I would say, the patient, Sam Smith, is 2 days post-op for an internal fixation of a femur fracture from a mechanical fall at home. He receives metformin for his type 2 diabetes 2 times a day, and today the patient's metformin was administered at 8 a.m. However, he has a CT scan with contrast scheduled for this afternoon, and due to the black box warning for lactic acidosis, when using metformin with any sort of contrast, I recommend that the CT scan should be rescheduled so that the metformin can be discontinued beforehand. And additionally, I'm going to request orders for a medication to be used in place of the metformin for 48 hours after the CT scan and perhaps before the CT scan. For the fourth question, when explaining what heparin is and why Sam Smith is going to be receiving it, I would tell the patient that heparin is an anticoagulant, but he may know it as a blood thinner. And what heparin does is it decreases clotting of the blood, and he is being given heparin because he's post-op for a surgery, And so he's being given heparin in order to prevent his blood from forming a harmful clot that could travel to his lungs or his brain or restrict blood flow or cause any other issues while he's healing from his surgery. For question number 5, I would respond to Sam by saying that the maximum recommended daily dose of Tylenol is about 4,000 milligrams, and he was exceeding that dose at home when he was taking 5,000 milligrams. And so due to the hepatotoxic effects of Tylenol, he won't be receiving the same dose as he did when he was at home here in the hospital. But I would also offer him ibuprofen to help manage his arthritis and pain, or non-pharmacological solutions or interventions such as massage or range of motion exercises. And for the 6th question, I would respond to Mr. Smith by saying that his Tylenol is a PRN 4 hours medication, meaning that he can have it when needed or when indicated, but administration times of the med must be 4 hours apart from each other. And since he received his Tylenol 2 hours ago, it has not been 4 hours and he can't take the med again yet. But I would offer him either ibuprofen or non-pharmacological solutions to manage his pain in this instance.